Welcome everybody to the Clique Podcast, your show for DAO insights and deep dives. The space is really hard to track on your own. There's so much going on in this space. So we have some of the best DAO operators and thought leaders to kind of give us the insights so that you can be savvy of what's going on in the space. My name is Abhishek Ajit, and along with me is my co-host Abhishek Sanavne. Hey Abhishek, what's up? How are you doing?
Hey man, really pumped for this one. We've been prepping up for almost about a week, and really looking forward to it.
Absolutely. So am I. Really stoked to see this community. What happens when you have this space? You kind of see the space which is filled with a lot of speculators, and it's only been the advent of DeSci and some other certain verticals that you see real world use cases that come in. What happens when a bunch of community people really down in the medical world come together to create a DAO that can make an impact for what's really stagnant in the medical world? We have with us MedDAO. We have with us some of the key operators of MedDAO joining us today. Dr. Brad, Zacharia, and George Cecil, who are the main DAO operators of this space. Hi, Brad. Hi, George. How are you doing? Glad to have you on the show.
Hey, thanks. Yeah, thanks for having us, Abhi and Abhishek. Appreciate it.
Amazing. So I don't want to take up all the intro. I tend to butcher it a lot. So I would leave it to you guys. What exactly is MedDAO all about for all our listeners? I think MedDAO is a nascent project, and we're happy to have you on for your first ever podcast. So do tell the world, what exactly is MedDAO all about?
Yeah, appreciate that. And thanks for having us on. I think MedDAO is a decentralized medical knowledge network. Again, like you said, in its kind of nascent stages, with the idea to leverage kind of all the powers that Web3 decentralized governance and ownership bring to the medical space. And so I know that's kind of a broad 30,000 foot view, and we got time to dive in deeper into kind of what does that mean, what's our target community, and how do we see this taking shape.
Absolutely. Having taken a look at your community, you guys have massive ambitions. You have a lot of verticals within that roadmap of yours, and we're happy for our listeners. We are going to get into a deep dive of exactly what their verticals are and why they're doing this. So before we get into all of that, we want to understand more of both your backgrounds. Brad, George, you've both had decent experience in the med world. I mean, especially you, Brad. I mean, you've been a neurosurgeon. Yeah. Okay, but I'm spoiling it for our listeners. Why don't you step in and tell our listeners about what exactly your background is?
Yeah, absolutely. So by day, I am a neurosurgeon. Myself and Dr. Morgan Stewart, who's unable to make the call today, is feeling under the weather, did our training together at Columbia University and Columbia Medical Center, and had kind of birthed this idea now going back almost maybe 14, 16 months. Really, we can get into more of the origin story here, but we're in a very different, I think, philosophical place now than we were then. But that's my background. So I'm a clinician first. I'm a surgeon. And so that's kind of obviously where the bulk of my time is spent, but obviously lots of touch points with the healthcare system and space, and interested to see how this kind of translates to Web3 and that knowledge and expertise, and that's part of what MedDAO is trying to do.
Kind of during the day, I'm in Web3 venture capital, focused on kind of financial adoption of blockchain technology. So we're very much so focused on blockchain infrastructure. And, after kind of connecting with Brad and, bringing some of that kind of infrastructure, hopefully adding something there, just saw the vision and it got really excited to kind of join the team, and I've been working kind of hard at it for pretty much almost a year now.
I think that's amazing. We have two people here with completely diverse backgrounds here. I mean, Brad, you're a neurosurgeon, and George, you've been someone who's been really passionate about kind of trying to make this thing work and create that sort of infrastructure for the medical world. What I find fascinating is why did you guys come together to do this? Because we have people who come in for the speculation. We have people who come in because they see the potential upside. And what has been your story of what's been going on with the medical world? We've had probably Eugene Leventhal from SCRF, who was working as public policy and partnerships for Carnegie Mellon. And seeing the state of affairs of what's going on with the research ecosystem, he saw that the Web3 world brought in an energy, a massive, the amount of experimentation that was done to reinvent what's done with the whole research and bring in a new set of networks that could transform research. These are the sort of people that we just started to see with the whole DAO space. But what's been your story? You've been a neurosurgeon, and what's going on with the medical world today that made you feel that, yes, Web3 is a space to be?
Yeah, well, I think that's such a good point you make about kind of the it maybe DeSci, this whole DeSci movement starting off kind of on the research side, and obviously massive issues there that are starting to be addressed in Web3, and the healthcare system is no different. Now, some of what I'm going to say is somewhat unique to the United States, but I think it plays at large kind of globally. The healthcare system is less than ideal. I think that's putting it politely. It's any number of massive things that we could tackle individually, but on the one part, it's siloed. The data is siloed, clinicians are siloed. Patients don't have ready access to their data. They don't have ready access to the clinicians. They're oftentimes geographically restricted or restricted by insurance mandates. The health systems don't speak with each other. Physicians have, over time, their autonomy has just been chipped away. Very few physicians anymore, from a percentage standpoint, work independently. Most work for a large healthcare system or a private equity fund. And so over time, we've seen this stripping of autonomy, this increase of administrative burden and administrators that has really kind of changed the landscape. And I think opened the door for a lot of innovation, which tends to hit the medical system last.
Yeah, and I would also say, we're really focused on not really disrupting the healthcare system. It's we kind of see ourselves as much more of building this new kind of healthcare value layer. So we've always thought that was important. And kind of once again getting back to what Brad initially said, building this medical knowledge network. How do we move this asset of medical knowledge between, patient to patient, doctors to doctors, eventually, doctors to patients, perhaps, although we're being, very careful on that front, given kind of the legal challenges. That's kind of been the goal since day one. And I think it's really evolved since then, obviously, as we've added new, team members, et cetera. But we've pretty much stayed pretty true to that message since day one, which has been great.
The way you've seen use cases pile up in the whole blockchain world itself, you've seen a lot of teams come in to kind of make a difference with the medical world itself. You have IBM, Hyperledger, and all these vendors just come in and try to implement these use cases for the medical world. Why do they do that? It's because the way the world is currently running, as Brad mentioned, throughout the whole pipeline between a doctor and what's going on with the hospital, there are a lot of middlemen that come in that really create conflict of interest for a lot of the whole players within that pipeline. And the question is, do patients get that sort of data sovereignty about their own medical conditions? And because of the whole conflict of interest between what's going on with the hospitals or the private data vendor having access to that data, are patients really in control of their data? Are they able to share it with that sort of doctors that are able to count? Also, the issues with the jurisdiction is that you are limited to the sort of doctors that you see around you. But the internet is completely connected across the globe. In spite of we being in 2022, we still haven't reached a phase where there is this connect with the medical talent across the globe and a patient who really deserves that sort of care. There are so many conditions that are kind of rare, but there must be some sort of medical solutions that happen in some other part of the country. But because of the way the networks currently function, it's so siloed that patients don't get that sort of access. And it's only personally, with the way DAOs kind of function, where people come together and are able to share information, and you have the community coming in to be able to create these sort of layers for coordination, that I personally see a major step forward for the medical world. But what exactly is your story here? I mean, what did you see with Web3 that made you feel that you wanted to create MedDAO in the first place?
Yeah, I think you hit on several just massive kind of issues that I think can partly be addressed by Web3. The first is the sovereignty of patient data. So I would say the short answer in the current day and age is no. The patients do not have sovereignty over their data. Yes, you could request that your data be shared with another physician. If you want, you could request that data. Historically, that's been getting a paper printout, getting a CD made, maybe at your own cost. If you've seen multiple providers, there's no way to collate that data. And that data is being used by these electronic medical record systems, maybe without your identifying information, but without your express consent to do studies, and they're selling that data. And so you can imagine there's actually been legislation passed in the United States that mandates that patients have access electronically to their data now. And so that's just come through. And so to see how that's going to alter things is going to be important. And there are many players in the Web3 space who are specifically working on patient data sovereignty, having it in your wallet, having it on chain, having it so you could share it with whoever you want. So I think Web3 is going to solve that problem ultimately. Now, we're not solving that problem, but we see ourselves as consumers of that data, of a place where that data may be chosen to be shared. And again, as part of this new value layer in healthcare and essentially kind of the Web3 shop for clinicians in Web3 space being beneficiaries of that, contributors and users of that data. That's the first point. The other point that you brought up, and I think this is a touchy point, which is kind of the lack of global access to providers and breaking down these barriers, right? So yes, medicine siloed even within an individual state, within an individual country, and then certainly globally, you're limited by legal jurisdiction, licensing requirements, insurance costs, etc. Many things that in the internet age have disappeared. And the reality is the COVID pandemic have really brought those things to light, where telehealth, telemedicine was, we were forced to leverage it. It accelerated it at 100x across most health systems. We saw overnight the ability to change legislation in a way to make it feasible, right? Whereas it was illegal yesterday, now all of a sudden they made it legal because it was necessary. So we don't see ourselves, certainly in the early days or any time in the near future, as being a place for patients to get direct access to providers for medical care. And I think we've been very clear about that and very deliberate because of many of these medical legal issues that are going to lag behind the technology. So part of what MedDAO is doing, and part of one of the sub-DAOs and working groups that we could get into later, is a medical legal group. And we've partnered with LexDAO, who's been our kind of legal support, and talk more about that. But clearly, the direct provision of patient care is going to be really challenging for some time. So I think where we see ourselves is this expert network, and particularly harnessing not just the expertise of the clinicians, but also the input, the knowledge, the experience of the patients, of the caregivers, with the understanding that everybody touches the healthcare system, whether you're a doctor, a nurse, a patient, a caregiver. Everybody's been in touch with it and probably suffered some of the pains that come along with that.
I think having, some sort of, patient self-advocate groups is something that doesn't really exist in today's world and could be very helpful to potentially millions of people, right? And the other piece that you touched on was kind of this globalization of medical knowledge, right? How do doctors or others with medical knowledge kind of typically make contacts, build their professional relationships in the space, right? That's through, medical school, through residency, through conferences, perhaps, et cetera, et cetera. But, through something like MedDAO, you can absolutely envision them being able to kind of have a much further reach, connecting with, Brad could connect with neurosurgeons elsewhere who are perhaps working on something very interesting in the space that, he hadn't thought of before. So that's definitely something that we've, tried to focus on in growing the DAO.
So, I mean, you've touched upon a lot of key points. You wanted to kind of create a layer where you don't want to be the main point of contacts for having that sort of direct healthcare solution, but you want to be that layer that facilitates it between these doctors as well as the patients. You want to have patients be able to share that sort of data so that it becomes easier for doctors to kind of come in and learn and be able to understand more of how they could treat patients who have that sort of similar issues down the road. And at the same time, you've also mentioned that you want to have that sort of support groups where people could come in and kind of seek that sort of help. I have, in spite of us being in this internet age where you have massive communities for trading, for gaming, but yet, support groups for various conditions are just restricted to Facebook groups or probably a couple of WhatsApp groups, but there's nothing really coordinated. And I know that there's a lot more to MedDAO than this. You have so many moving parts in there. We can break this down into two. I mean, if someone's walking into the Discord right now, I mean, of course, you guys are still nascent, but what exactly can someone who's new to MedDAO expect now and what's coming in the next couple of months, and where exactly do you see this going probably a year or two down the road, if you're being really optimistic?
Yeah. No, we're definitely optimists. So I think if you walk into Discord today, if you sign up, the first thing we do is we try to direct you to a working group. It's how obviously how a lot of DAOs are organized, but we have working groups for marketing, governance, operations, medical, legal, working group leads. There are communication channels just for those working groups, weekly meetings for those working groups with kind of express goals to kind of push those parts of the DAO. We're utilizing DWorks as a bounty board system, so that bounties will be put up there for individual kind of tasks and asks and things that are helpful to the DAO in exchange for our what is now at this point a non-transferable governance token, MED. And I think that's the primary way that people are going to kind of interact with that. For people who are then organizing or sub-organizing within a given either medical subspecialty or along a disease line or some cohesive line, we're encouraging people to organize into sub-DAOs, which are, again, I think sub-DAO becomes this controversial maybe some syntax because they're not really below the DAO. It's really a hierarchical system where there's some guardrails, but they really will operate independently. They'll have their own multi-sig, their own governance process within some framework. But you can envision there being a psychiatry sub-DAO that has psychiatrists, that has patients, that has caregivers all coming together and maybe working on their own product, their own systems, their own means of garnering liquidity and working within the larger DAO ecosystem. Those are I think the main ways that people are going to get involved now. And then George can maybe speak to the KR and to maybe MedCred too.
Yeah. And at a high level, just kind of touching again on the structure of our DAO. So at the highest level, you have MedDAO, the super DAO, essentially. And then kind of off of that, we allow these, sub DAOs to be created using a sub DAO creation proposal, which can be found on our discourse forum. But essentially, what is a sub DAO, right? It has its own multi-sig, its vision, somewhat aligns most likely with, MedDAO's vision. And the whole goal is, to allow them to perhaps it's a totally open community and anyone can join. Perhaps, they want both doctors and medical industry participants in it. So one of the kind of first things that we're working on here with a couple of partners is MedCred, which is our kind of credentialing solution. At first, we envisioned kind of building it out for medical practitioners based off of ADMS's subspecialties. What are there? 24, I believe. And the goal here is really to mint a non-transferable NFT to a wallet, showing that this wallet address does, in fact, belong to a medical practitioner of a certain subspecialty. And that will allow you to essentially gate communities, right? So perhaps you have, using Brad as an example, a neurosurgery sub-DAO. And then kind of the whole goal of the DAO is to support these sub-DAOs and build out use cases for these sub-DAOs. Perhaps some of the use cases are built by the sub-DAOs themselves, but then to also have essentially white label use cases as well. And one of the first ones that we've proposed there is a knowledge request, which is essentially, someone external to the DAO, or perhaps even internal, comes and simply asks a question, members of the sub-DAO. You can think of it as essentially, a bounty, right? So more information for all of this can be found in our Git book as well, which is located at our website, MedDAO.xyz. But at a high level, that's kind of the structure and some of the initial use cases here.
So the way I see it, you have MedDAO as a broad super DAO, having a governance token called Med, where all the doctors are kind of being verified by the MedCred NFT, and sub-DAOs are kind of created for the general operations as well as creating the support groups / knowledge transfer sub-DAOs for various medical verticals like psychiatry or whatever the community kind of brings it up. Have I got that right?
Yeah, no, I think that's spot on. I think there's where does kind of the super DAO come into play, right? So there's the sub DAO creation proposal process that's voted on by all members of MedDAO, and then if approved, you're requiring 3 members or five members minimum to start a sub DAO. They could set their own requirements for membership, and then ultimately you'll be kind of minted a separate NFT that will provide you access to their Discord channel and to their own governance structure, however they deem that to be. They're going to have their own treasury, and that'll have some stake of Med in it, so that the sub DAO itself and its members will have obviously voting rights within the overall MedDAO structure, but they're going to have their own structure, completely, essentially be financially sovereign, with a very small kind of administrative, the kind of take rate kind of going back to the MedDAO treasury, which is really utilized to just enhance the DAO, right? So again, we see the whole ecosystem is really kind of a service DAO, but MedDAO being almost a service DAO to these sub DAOs, right? Kind of ultimately what we aim to provide. So George mentioned the MedCred and the knowledge request, but almost what in essence is a DAO in a box, a sub DAO in a box, if you will, where as opposed, you get a group of providers or patients, providers and stakeholders who are interested in something, and the lift for them to get all this architecture in place to start their own kind of medical DAO on that specialty would be huge. And if they could just come in, there's a community built around it, and they could form a community within here with the support of the ecosystem. Also, essentially that as an offering, unto itself.
And part of that important support, right, is our working groups, which in some other DAOs are referred to as guilds, right? But essentially, the goal is we have this infrastructure set up for them and teams that are, ready and able to kind of help them along their journeys.
The way I see it, you're not just a service DAO per se. You're actually building very key product lines that I think almost all teams have kind of failed to deliver till now. That is the knowledge request framework, where patient data can be kind of delivered to the doctor of his choice, in a very sovereign manner. And the other one is the credentialing for these doctors, where, you have these databases. You'll have to kind of link up with those particular NFTs and match if they are kind of legit or not. And those are two real dicey use cases that you're kind of tackling right there, So along with the sub DAOs, I think you're taking up a lot, But stepping back away from the product aspect, when I think of the way you're building this community, you mentioned that you're allowing for sub-DAOs so early in the game, and you have it for operations, you have it for these verticals, and this is a completely different space. This is, you're having stakeholders like patients and doctors, and the way the structure is developed around them, I feel should be seen in a very different way than what's kind of done with a trading or a service DAO per se. What I want to understand from your experience is that, see, patients and doctors are coming in, they want to solve their problems. And right now, what this whole ecosystem is done is you're bringing in this aspect of financialization throughout the ecosystem. You take a look at what's going on in every other ecosystem out there. There's always that the price mentality that kind of comes in when you kind of deal with the ecosystem. But patients, they're more concerned about kind of solving their issue that they've talked to probably 50, 60 doctors. So how do you kind of create this sort of space? The way you grow your community, I think that's a completely different design problem than how communities have grown in NFTs or in Web3. How do you plan to create this sort of safe space where patients can feel comfortable knowing that they have the best people around and they can share it in a way where you don't have to sit and see when moon or wow, there's a governance happening. How do you create that sort of space? Because you're a neurosurgeon, you've been around these sort of communities where it's you've been able to create these spaces. How do you plan to transfer some of those learnings to MedDAO?
Yeah, again, I think there are two kind of points buried in there that I think are important. I think the first is as regards kind of patient data and the security and kind of creating the safe space. So I think we're being very deliberate early days that this is explicitly not a place for you to come tell us what your medical problem is and for us to give you an answer, because we understand that there's massive challenges that come along, data security challenges, legal challenges that we just, I think if we try to tackle those out of the gate, we're going to falter. And so I think this is more for the patient who says, I have this disease and I want to help other patients. I want to make it better. I want to help find research dollars. I want to make sure the clinicians understand what it's like for somebody with this disease. And I want to be a part of this community. And so I think that's kind of where we come from the patient standpoint. As far as this constant pull, like you said, there's a big chicken egg problem here, right? We want to build this community, but how do you build a community without an offering or some potential for liquidity? But there's no potential for liquidity really without the community. And so it's this balance. I think very much we've also been deliberate. This is not an NFT shilling, we want your money kind of project. We're looking for people who really want to build. Obviously, this is a native Web3 ecosystem with really no Web2 tie-in. So certainly the early people and participants are going to be relatively savvy in the Web3 space because we know that the real heavy lift is bringing the next 10,000 people into the DAO who don't have a MetaMask wallet and have never used Discord before, and that lift is enormous, right? So I think we're focusing on these early people who are focused, who want to build, and that's where kind of the MedCred, the knowledge request is kind of proof of concept that there is going to be some mechanism for potential liquidity at some point. And also one of the reasons I think we feel we need to allow the sub-DAOs kind of broad leeway and getting them involved early is, if people don't feel like they could go and turn and create products that again may net them liquidity, they're going to lose interest. And how do you maintain the interests of busy clinicians or patients or caregivers who've got their attention pulled in a million different directions? What's their hook to stay within this community? And so I think as we scale, some of these issues will become less and less because as the community scales, the argument to stay within the ecosystem becomes pretty easy. Like we have this big ecosystem, but obviously in its early days, we're partnering with everybody who joins. Everybody who wants to build a sub-DAO, they're also building MedDAO. So
adding a couple of things to that, I actually not sure if you guys can see my screen here, but pulled up something from our kind of community deck here. Slide 11. It's in our Git book as well at docs.meddao.xyz. But essentially, this is kind of how we imagine the community growing at first, right? You kind of have these Web3 natives at first, and then kind of expanding all the way out to kind of Web2 natives over time. Something else that I definitely wanted to point on or touch on was, there's obviously this very large kind of philanthropic goal in mind. But that being said, we've always been aware that it's, you have to have some sort of revenue model to be sustainable. So kind of since day one, we've realized that you need, these kind of revenue pieces in place in order to kind of grow, scale, and kind of, maintain your community.
I mean, the whole revenue aspect makes a lot of sense. You're still kind of nascent and you want to focus on creating the layers before the communities really come into the play. My question is, once those layers are kind of set and, you have the overall models kind of set, what is going, now you've mentioned that currently it's going to be, getting in those key stakeholders who can kind of create the whole setup around the Web3 angle itself. But then later down the road, when you have to grow this community, the way each of these communities should be delineated, how do you plan to grow that? Because you still need that medical talent to come in for example, the psychiatry DAO, for example, any sort of medical verticals, the way in which you kind of attract them to become this hub where, knowledge transfer becomes effective, how do you plan to grow that? Brad, what has been your story that way? You've been a neurosurgeon and it got you into Web3, but Web3 is a tough game, it's not very easy to kind of deal with all these aspects. And how do you expect the broader community to come, the medical professionals to come in and play a role down the road?
Yeah, no, it's a massive challenge. And to that point, that's one of the reasons we're starting off with people who are native to Web3. But yeah, certainly we want to pivot quickly to how do we onboard those other physicians who have limited knowledge. And so I think there's going to be a massive educational piece to this. We've talked about kind of like Web3 medical school, designing kind of POAPs, maybe bounties associated with that, like receiving med in exchange, similar to like a Coinbase model. You learn about a coin, you get a little bit of it. Educational models, how do you make a MetaMask wallet? How do you utilize Discord? How do you get involved? And I think, what we envision, you talk about timeline, envision over the next several months, getting to the point where we have several sub-DAOs, where the working groups are kind of firing on all cylinders, where we have, 20, 30, 40 different DWorks bounties on there, where we could easily guide someone with limited knowledge of the space to not feel lost when they jump in. But yeah, it's a big leap. I think it's going to require a lot of time, attention, and kind of hand-holding initially. And, again, I think, the assumption or the hope is part of a broader push to Web3, more people becoming savvy, the tooling around Web3 becoming more and more sophisticated, right? Because right now we know that there are a lot of things that we do that are on Web3 that we do just because they're Web3, but aren't necessarily better than the Web2 variants. And I think, that's just a matter of time, right, before they improve. So yeah, it's an important point. It's going to be a challenging one.
Yeah, no, I think Brad pretty much kind of hit on all the key points. We definitely realize, most of what we're doing is, a pretty new frontier. So we've tried to remain, very diligent and make, the right decisions. Are fully aware that, at origin, there were only 4 of us. Now, obviously, much larger, but that we don't have all the answers here. And so that's where, the community kind of comes in and plays a key part. And, already since launch, which, has only been, about 2 weeks now, we've had some really smart new additions to the community, to the team, who are already, forcing us to think about issues that, maybe we thought were important, but we didn't realize, how immediate the need was, how important it would be to the community. So I think it's, great. And with every kind of additional, community member, we're building this new cohort, right? So the name of the game, I think, is to continue to build these cohorts where each one is, educating the next one and so on and so forth. And then also bringing in their own expertise from, their medical or, Web3 journeys.
I mean, considering how nascent this whole thing, I think that's a pretty comprehensive answer right there, I mean, you take a look at Desai itself, none of these, the sort of massive ecosystems that we see today with Vitadao, with Molecule, the origin of it has always been the underlying ideas of where this could go, and the more, you could kind of market that, and the more you could present that within the broader community itself. I think the best example is Brad right here. I mean, you don't see a lot of neurosurgeons within Web3. You don't see the medical world itself have this whole intersection right here. And you have Dr. Brad over here, you have Morgan, who are kind of coming in and trying to make that change and putting that story out there, putting the story of the community who is coming in to make that achievement possible could be the underlying reason for the broader community to step in, as always. An underlying narrative of the personal story has always been a brilliant way of kind of getting in a community to come together. And once that inspiration does come in, then building that sort of cohorts where they can learn that sort of the technology will always just come into play. And what I wanted to understand more is you have the medical the side where they can come in and really understand more of how they can contribute to MedDAO. But what about the plebs like us? I mean, it's tough enough to learn Web3, right? Besides the general conversation about when moon or when floor price go up. But here you have to be very valuable to the MedDAO community. You have so many stakeholders, and it's a very delicate balance of trying to make that community work, in spite of you having the MedDAO for the governance aspect and having the KRP framework, which we'll get to in a bit. How do you expect the general Web3 people to be when they step into MedDAO? How do we play that sort of role?
Yeah, no, and again, I mean, I think we have, the majority of members are not physicians, and I think they have tremendous value add, right? Because in a similar way, we can't be the devs. We don't know what to do. And so we may have an idea, but we need to kind of ground that in reality. And so, a developer, we have team members who've had, family experiences with a disease, that they become caregivers themselves that have kind of pushed them into, learning and knowing about healthcare, but who are not healthcare providers, who are marketing people, who are development people. And so I think everybody has a touch point with the healthcare system. And so may have a reason to get involved. It's also, people like a challenge. This is a challenging space. It is not an easily solvable problem, and it's not going to be just clinicians. And so I think what we've seen is, these folks that have come on board that don't have the medical background or expertise, but have expertise in other areas. When we all put our heads together, really some unique solutions, ideas, and concepts start coming to play. And I think people see that and it kind of grabs them. So I think these people who, especially kind of in this, kind of crypto winter kind of bear market where a lot of these NFT projects have just fizzled out, these people are left with, well, like, what do we do now? What about something with a higher purpose, not some kind of get rich quick scheme, but something that may have broader implications and really demonstrate, like, what is really the true power value prop for Web3 going in the future, and wanted to be part of something bigger. And so I think we're hoping to be maybe a landing space for some of these folks who are kind of left spinning their wheels a little bit, maybe a little disillusioned, and join a project where, we're trying to do something huge.
And something else I wanted to touch on here is it's really also on the community to do a lot of this outreach, right? To continue to build the tools. We think we've provided a pretty solid, infrastructure to do a lot of this. But like a party that we expect to, be a huge user of MedDAO and its sub-DAOs would be like medical industry, right? I mean, think about the value that the sub-DAOs and community as a whole can provide to medical industry as a whole. So, but obviously, you know, even medical industry are not Web3 natives. So how do we build these kind of, you know, Web2 feeling tools to kind of best serve and interact with medical industry participants?
Boils down to how do you develop that sort of community either way, you know, where they can kind of be a reliable point of contacts across the broad ecosystem in general. And looking at the way the infrastructure is being thought of, I mean, you have the knowledge request framework itself, which will be a key underlying piece, you know. I want to like touch upon that for a bit. You've mentioned what exactly is the whole framework going to be about, you know. I wanted to understand more about what sort of data, you know, just kind of flows within this infra, and what are the implications of having it on a public blockchain, you know, in terms of the legal issues and all of that. How do you plan to traverse all of these things?
Yeah, so on the legal front, you know, I think we've been very careful. Obviously, you know, from my kind of day job in Web3 venture capital, it's something that, you know, we spend a lot of time thinking about, especially when talking about, you know, engaging with regulated financial institutions who obviously have these massive regulators. I think, you know, that can tie to the medical space where medical is even more regulated, right? And I think you asked on tooling there as well, right?
And just a broad overview of what the whole knowledge request framework would look like, you know, to someone, to a patient or to a doctor, what would that whole flow look like?
Yep, totally. And once again, I would point, you know, everyone to our Git book here, docs.meddao.xyz, where there's a full kind of walkthrough of what this will look like, kind of minimum viable product, version 1, and then version 1.1. Although I'm sure we will, you know, be changing that over time. But essentially, you know, in the very kind of, you know, minimum viable product piece, right? Just something that's not scalable to demonstrate some product market fit. It's as simple as, you know, kind of filling out a Google form, which then goes into, you know, a Notion database, is then published onto, you know, dWork as a bounty, and then allows, you know, whoever is being targeted in that knowledge request to come in, answer it, and, you know, essentially complete the entire knowledge request loop. I think if you know, look more into our docs, it gets significantly more complicated pretty quickly, right? How do we add feedback loops? How do we ensure that the quality of the knowledge that's being shared is kind of up to par? But at a very, very basic level, I would kind of say that's
I mean, I think like let me give a quick example of something that like you can envision that's, again, not on the patient care side. Somebody, you know, there's a lot of people who are publishing now in non-peer reviewed formats like RxIV, where you would put your non-peer reviewed article on there, right? And we know the whole medical publishing system is crazy. But maybe you want that reviewed by a group of clinicians who are in that space. You might say, hey, I'm going to, you know, put up a bounty of X amount of USDC, any coin for that matter. And I'd like, you know, a group of 5 neurosurgeons to review my article. And that would get put up as a bounty. There's going to be some administrative layer. It'll be taken up. We'll provide that work product will be put out, that USDC will be escrowed and then kind of released. And again, we'll become increasingly sophisticated, automated, multiple layers of checks and balances. But that's the idea. And right, that could be an individual person looking at it. That could be, again, medical industry, who I think George was mentioning before. We all know are not Web3 sophisticates. But so again, it's going to be kind of spoon feeding a little bit early and partnering with some of these medical industry players. We're saying, hey, look, you maybe want access to this space and to some of the providers in this space. Like, why don't you work with us and let's come up with some kind of knowledge request that you might have and put it through the system, and let's see how that works. Things of that nature. Ultimately, might it be a drug company wanting to get to put up a survey to patients with eczema and find out what they want to do, and the idea being that we're going to have super engaged patients, providers, caregivers who may provide valuable knowledge and expertise to these medical industry or government or medical legal system. So that's kind of just the rough kind of thing. And again, I think, as George said, this is in many ways a proof of concept, a minimum viable product to show that there's potential for revenue, for some way to gain something from this.
Sorry, real fast. Maybe I think, although we've been very specific to say, we're not focused on patient-facing use cases at first, I think it's a good kind of example for, the average everyday person to kind of understand the knowledge request. Let's say that, knock on wood, I have a brain tumor, right? I go to my doctor, to my neurosurgeon. He runs some tests, says, hey, this is what I think you should kind of move forward with. And I say, hey, this is a pretty important life decision, if not, the most important, quite literally, is my health. So to get, typically I would have to, go to another neurosurgeon. Maybe I have a contact or two, get their opinion. But in this, you could really take your data, your results from these tests. You don't even have to upload any PII, right? And I think something day one that we've been very focused on is, obviously, we don't want this data living on chain. We're, being very careful about this. We think that, decentralized storage will play a huge role here. But then I could essentially, upload that data to the knowledge request, which would then, be sent to the neurosurgery sub-DAO. And I could essentially, I could choose how many doctors I wanted to opine on, my results, and have, within 48 hours, you could potentially see me getting, 100 opinions from neurosurgeons. And that could be incredibly valuable on two fronts, right? One, you're establishing consensus as to what all these neurosurgeons think I should move forward with. And two, you're getting options that perhaps, your neurosurgeon didn't even know about, right? We're talking about the globalization of medicine here again. Maybe there's some trial that I haven't even looked into that might be perfect for my case. So once again, how do we, transfer this medical knowledge in a more efficient and kind of global manner?
I think to George's point, that's not the primary initial use case, but it's certainly conceptually very easy to see how that works. And as more people own their data, as their data is readily available in their wallet for them to control and share, then it becomes a really obvious, okay, so now I have my data here. It's mine. I can share it with people. They don't need to know who I am. I don't need to know who they are, other than knowing that they're medically credentialed and they actually are something that's enough for me. You can see there's lots of potential there. So
the way you see it, you're allowing for this whole network of information to flow from the medical industry, from doctors and to patients who really need that sort of advice. What you're talking about, the whole patient side of it, that's not your current use case now, but later, very far down the road, you could probably see that sort of flow of data happen someday. And with that itself, the sort of potential that you guys are trying to build, it's pretty wild that way. Any sort of medical company, they don't need to wait for a long time to kind of trial out some sort of a solution or something like that, as long as they have access to the global patients itself, rather than being stuck to a certain jurisdiction where a certain rare disease, you're not able to kind of get your patients within a jurisdiction, but you can tap into a global community where having that sort of data transfer happen in sovereign manner becomes possible that way. And the sort of work that you're doing to create that sort of community, it's pretty amazing. It's a tough challenge, bringing together doctors across different verticals to come and be a part of the MedDAO, considering how nascent Web3 is for everything in general. But really fascinated to see what MedDAO will kind of create down the road. I think I personally am a big fan of the team in general. And what can we, as just to close the episode now, what can we expect from the team today? How can a person contribute now? And most importantly, you guys have been phenomenal. It's been amazing having you in the convo. Where can people find you and kind of connect with you and your insights?
Can't thank you guys enough for having us on. I think this has been a really, really great conversation. You guys have I started digging deep, and as you know, doing podcasts like this, we could speak for hours on any one of these topics, and so it's great to give a high level overview. I think if people want to get involved, the best way is to come find us on the web. It's got links to all our documentation in Gitbook and Notion, and join the Discord. Just play around, see what the conversations are. Come join in one of our weekly syncs, and then see if it's you're feeling the community, and as you want to get involved more and more, get involved in the working groups and start thinking sub DAOs and other use cases. But it's a small team still, and so you feel free to kind of reach out to us directly, DM us on Discord, and we're interested in anybody who sees issues perhaps with the healthcare system, who's Web3 savvy, who's interested. Happy to have you part of the team.
Yeah, and then we're on all the traditional channels as well. Twitter, LinkedIn, everything you can think of. So I definitely encourage, anyone that our message resonates with, whether you're professionally part of the medical community or not, to come check us out. Check out our documents. We're really excited about it, and I've been extremely impressed with the members that have joined so far, and are really excited to continue to grow.
It's not every day we get to be a part of the whole medical journey itself, as plebs sitting outside the whole medical world itself. The beauty of Desai is that for now, the community need not have that sort of doctorates, or you don't need to be a part of that whole industry now. You now have a chance to play a role in what is the most connected network to kind of tackle all these hard problems, and really looking forward to the work that you guys are doing. It's been amazing having you. Listeners, do kind of follow MedDAO and be a part of their journey. They're doing fantastic work. And with that, stay tuned for the next episode. It's been great having you all.